Mesothelioma is an aggressive form of cancer that develops from the mesothelium, the protective lining that covers many of the internal organs. The main treatment options for mesothelioma are surgery, chemotherapy, and radiation. While some alternative therapies may provide supportive care for side effects of standard treatments, there are certain alternative therapies that mesothelioma patients should avoid as they could potentially interfere with standard medical treatments or have health risks. One therapy to avoid is SCAC tea. SCAC tea is an herbal tea containing ingredients like burdock root, slipper elm, sheep sorrel, and turkey rhubarb. Proponents claim it can treat cancer, but there is no reliable scientific evidence that it is effective against mesothelioma or any cancer. In fact, SCAC tea could negatively interact with chemotherapy medications or weaken their anti-cancer effects. It also has not been tested for side effects when taken with standard mesothelioma treatments. As the components and dosage in SCAC tea can vary, it introduces an uncertain element that may interfere with or compromise a patient's standard cancer treatment plan designed by an oncologist. Another therapy to avoid is insulin potentiation therapy, IPT. IPT involves giving small doses of insulin to supposedly make chemotherapy more effective at killing cancer cells while causing fewer side effects. However, there is no convincing scientific evidence that IPT works against mesothelioma. More importantly, intentionally manipulating insulin levels could dangerously interact with chemotherapy medications or other drugs a patient may be taking. Insulin is also a very potent hormone, and manipulating it without close medical supervision poses health risks. IPT should be considered experimental and could compromise or interfere with standard, evidence-based mesothelioma treatment. High-dose vitamin C therapy is another alternative therapy mesothelioma patients should avoid. The theory behind high-dose for vitamin C is that it can generate reactive oxygen species to attack cancer cells. However, while vitamin C is generally safe in dietary amounts, high-dose for vitamin C has concerning potential side effects like oxidative stress, kidney failure, electrolyte abnormalities and interactions with various medications. More importantly, its effectiveness against mesothelioma has simply not been proven through well-designed clinical trials. Subjecting patients to uncertain risks from high-dose vitamin C provides no clear benefit and could distract from focus on evidence-based treatment. It is also important to avoid certain herbal supplements and teas while undergoing treatment for mesothelioma. Herbs like mistletoe extract, cat's claw, SCAC tea, as well as supplements like shark cartilage, can interact unpredictably with chemotherapy or immunotherapy drugs via their effects, components, or contaminants. Many herbs and supplements are not well regulated or standardized, and their effects on the body during cancer treatment are unknown. They introduce an uncontrolled variable that could potentially reduce the efficacy of medication or increase side effects. Some supplements like turmeric may also theoretically increase risk of bleeding issues if taken with blood thinners. Certain practices associated with traditional Chinese medicine such as acupuncture also pose risks. While acupuncture may provide symptomatic relief if given properly, its proponents often promote it as a possible treatment for cancer itself. However, there is no evidence that treats mesothelioma. Worse, quack acupuncturists have also delivered toxic chemotherapies or other medications through acupuncture needles, endangering lives. Receiving medical treatment from untrained practitioners can jeopardize health. While dietary and lifestyle changes, stress management techniques, yoga, and other complementary therapies can be useful for supporting wellness and quality of life as an adjunct to medical treatment, mesothelioma patients should avoid alternative medical treatments that have no proven effectiveness and could interfere with standard therapy or pose uncertain risks. A team-based, multidisciplinary approach focusing on standard evidence-based options tailored to each patient's unique situation usually leads to the best outcomes.